Hello, welcome back to my talk. So this will be second episode. I'm going to talk about the possible causes and predisposing factors of the colic in elephant. So this talk is constructed based on the observation in the real elephant cases. So elephant is the high gut fermenter and also comparable to rhinoceros and horses and donkey. So what does mean? The high gut is highly modified, and this picture show the natural constraint of the GI tract, where the location of the GI tract poses the bottlenecks. So in elephant, it seems to be at the end of the large colon before entering the small colon. So this probably the most location that the obstruction in elephant occur in the GI tract. So when I try to make the understanding about the GI anatomy of the elephant, it seemed like the information that accurately depict the GI tract of the elephant is really difficult to find. So none of these pictures seem to be accurate. Unlike in horses, that we know exactly where it's located and what is attached to what, something like that. So this information will be very useful to understand and to develop the idea of diagnosis and treatment. So let's look at this picture. This is a picture of the autopsy in the elephants filmed by the National Geographic. So we know that this is stomach, small intestine, cecum, and large colon before entering the small colon and go to rectum. So do we really know where it's located in the abdomen? That's questionable. So what is known and what not known? I mean, to my knowledge, for the oral cavity, so we know it's big, but it's very narrow because every when we try to open the mouth, um, the oral mucosa and the tissue just collapse and close all the cavities. For the teeth, we know that the elephant can get dental problem and can cause several problem. Esophagus, it's dilatable to 12 to 15 centimeters in diameter, and it has a bottleneck at the thoracic inlet. So this is from the case observation of the choke that I have a chance to get involved. The stomach is about 1 to 1.2 meters and can be up to 50 to 70 liters and have a strong cardiac sphincter. So again, this is from observation from passing the tube and passing the endoscopy. For the small intestine, it's about 15 to 20 meter and have a short mesentery and quick transit time. What we not know is, the species of the internal parasite. Do we know of them? I don't know. Cecum is 0.8 to 1 meter and located over the right pala lumbar fossa, so we know that. And it had a lot of internal parasite that we may not know. For the large intestine, this is the most difficult region of the intestine that can be understand. So basically, it's about 9 to 11 meter, and someone said approximately the 3 meter proximal part of the large intestine is attached to the cecum, and also have a bottleneck between the between the large and the small colon. So what we really don't know and I want to know is its location in the live animal and the blood supply and also the internal parasite. For the small colons, it's not much circulation like in the horse and it's relatively straight and thick wall, could be about 1.5 to 2 meters, and the rectum is very thick and very straightforward. Regarding with the transit time, so when comparing to the dog, from eating to poop, it could take about 21 to 57 hours. For the horse, it can take up to 60 days. For the elephants, I don't know, could be maybe 4 days. So this information we need to maybe need further investigation. So based on Mikota group study, they observed the capacity of the stomach and small intestine, cecum, colon in the Asian elephant and African elephant. So this is a very interesting number. We know that African elephant is bigger than Asian elephant, I mean in average. But when talking about the stomach here in the elephant, 76.6 versus in African elephant is 60 liters. It seemed weird to me. So it could be, in my opinion, it could be that the Asian elephant that's they got could be died from some kind of like abnormalities, like gastric dilatation before they being euthanized or die. So basically, what is colic? So again, colic is pain originating from the abdomen and including gut, like intestine, stomach. Could be abnormality in the peritoneum, blood vessel, or internal organs. So how can we know that the elephant get colic? If it's by the eyes, the colicky elephant usually depressed, restlessness, loss of appetite, rolling up. I don't know, maybe not. But some people said, could get up and down if you let them free. Looking at the abdomen, biting at the tip of the trunk, could be wide base stand or stretching the neck and and the distension of the abdomen. There are also the alteration in the vital sign, including tachycardia, tachypnea, alteration in mucous membrane color, dehydration because of not eating, increasing in CRT, and alteration in gut sound, and alteration in urine and fecal output, including amount and the characteristic. So the elephant that dehydrated, usually the urine is usually in a dark yellow color. So the possible common causes, we can divide it into, so this is a depth from horses a little bit. So maybe we can divide it into non-infectious and infectious. For the non-infectious, could be intraluminal obstruction, could be extraluminal obstruction, could be inflammation and ulceration, or dislocation of specific part of the GI tract, and non-GI illness that make the elephant show sign of colic. If it's caused by infectious, so this is a special form elephant, could be bacteria such as salmonellosis, Clostridium, or anthrax maybe, I don't know. Could be virus, need further investigation, internal parasite, that cause inflammation and ulceration and abnormal movement and obstruction. And whether it can be caused by protozoa, somebody know, I don't know. So talking about the parasite, so this is an example of the good one. So it's the stomach bud in elephants. So this specimen is collected in Myanmar. So this is a picture, the best picture that I can find. Could be male and female. So have anyone seen this kind of thing before? So now I'm gonna talking about the important predisposing factor in this species. I'll divide it into intrinsic factor and extrinsic factor. So the intrinsic factor is mean the elephant itself. So basically, the elephant is unable to regurgitate it like horses. And my hypothesis is it has a very strong cardiac sphincter. Stomach is pretty large, which is kind of like able to accumulate excessive amount of the food unnecessary. I mean, small diameter of the duodenum, short mesentery of the small intestine, and the unfixed position of the last colon. That is my hypothesis, but to be exactly sure, I think I need to get involved with one or two cases more for the necropsy. And the narrowing at the mid region of the colon, kind of like remember that I saw in one carcasses, and the alteration in the movement direction of the ingesta, especially in the large intestine, because everything inside is big and huge, and the large blind sac of the cecum also can cause some kind of like abnormality in there, and the bottleneck at the end of the last colon before entering the small colon. This is probably the one of the major and most important predisposing factor of the elephant to develop obstruction of the GI tract. Regarding with the extrinsic factor, definitely the domestication cause a problem, especially when the elephants have to work for a long period of time and lack of the availability of the water and the snack. Bad feeding practice, including the quantity, like feeding the elephant in a meal is a bad idea. If it's feeding in the large amount in each meal, also a bad idea. And inadequate water, several people have been discussed and suggested that elephant that has a limitation to access the water during the day may pose increasing the risk of the colic. uh, and a lot of could be the bad parasite control program, and several study I think that I encounter, they demonstrate that the parasite in the intestine can cause abnormal motility and maybe leading to the intussusception or the strangulation lesion. Teeth problem, I don't know how to deal with that yet. Maybe need more cases. And also the competitiveness among the individual when a lot of elephant is being kept together. If they're not being chained in apart, when the elephant finish that food, they might go to the other one and compete for the food. So that's my second episode about the possible causes and predisposing factor for the colic in elephant. Hope you enjoy it.